Dr. Evan Allen from Allen Wellness and Medical Center. Very excited to bring you number 2 in our video series about wheat belly and grain brain. Today we're going to talk more about the second claim that's put forward in the foreword to the book, that there's a large amount of people who have intestinal inflammation that don't have celiac disease, and that inflammation is caused by wheat. The book makes this claim but doesn't back it up. It actually fails to back it up. There's a case put forward by the book that the author's personal experience is really relevant. He describes an anecdote where he used an older form of wheat that hadn't been modified significantly, and he had lower blood sugars and felt better when he used that older form of wheat. Even the author himself is very clear that this is an unblinded, unscientific trial. And then the only other case of intestinal inflammation that's presented is a case of a woman who was very sick and having severe intestinal problems that had been diagnosed as ulcerative colitis, but that had not responded to therapy. And this patient ended up going on a gluten-free diet and getting markedly better. What isn't mentioned is that this patient had ever had what the book describes as the gold standard test to determine if she had celiac disease. And because it doesn't mention that, my suspicion is she never had that test. Unfortunately, what studies show is people with the most severe forms of celiac disease are often more likely to have all the other tests be negative, with the exception of the gold standard test. And so my suspicion is this is a patient who simply had misdiagnosed ulcerative colitis and actually had celiac disease, and therefore would have expected this patient to get better with the removal of gluten from her diet. Now, celiac disease is a very serious disease, but it affects a tiny minority of the population, and certainly if people are concerned about celiac disease, they should get that tested and check to see if they have it, and if they have it, they should avoid gluten. Just like people who are allergic to strawberries should avoid strawberries, but not everybody should avoid strawberries because there are some people who are allergic to them. The second claim the book makes in the foreword paragraph that we're talking about is that there are major, mental effects of eating gluten, and the book focuses on what happens when you take gluten and chop it up into little bits with digestive enzymes and then see what those digestive enzymes leave behind. Well, one of the things that are left behind are what are called exorphins. These are little chains of amino acids that mimic to some degree the effect of the opioids that people have that are put out naturally by their body when they do things like exercise or engage in something pleasurable. Now, those are obviously very similar to drugs like Percocet or hydrocodone, except that they're naturally occurring in the body and very safe. The book tries to focus on these as the major reason why wheat is, quote, addicting, except that wheat is not the only product that when we chop up into little peptides do we find opioids. They're present in all meats, all cheeses, certain numbers of other dairy products, including milk and yogurt and other things, and of course they're found in spinach. But of course there's not going to be any book called Spinach Belly anytime soon, and the only person that I know of who was ever addicted to spinach was Popeye. And certainly he was in great shape, right? So if you want to know more about this particular issue, we will be posting a blog post where you can read more in depth on our blog. We're very excited that you're following this series here on Allen Wellness Medical Center's blog video page, and look forward to posting another one soon. Thank you.